Hi. For anyone watching this who doesn't know me, my name is Graham, and I'm preparing to undergo orthognathic surgery in about 6 hours. It's 11:25 right now, and this is the night before my surgery. And I'm scheduled. I need to be at the I need to be at the hospital by 5:30, and surgery will take place around 7 o'clock or 7:30. I just thought I would make this video just to show uh, how my jaws are before surgery. Um, just like have some kind of record of me like actually speaking and like so people could see what it looked like and so I can see like what it looks like beforehand and like you see how drastic the change is between the before the surgery and then after the surgery. Uh, The procedure I'm having done is called a Lefort 1 osteectomy, bilateral sagittal split osteectomy. I guess those are two different procedures. One is uh, one is dealing with my top jaw and one is dealing with my bottom jaw. I have to have double jaw surgery because my top jaw is stunted. The growth stopped prematurely, and my bottom jaw continued growing past when it should have stopped. So now I've got this kind of thing going on, irregular bite. Um, so yeah, I started the process. I think 2010, February 25th, 2010 was when I got my braces put on. October the fall prior is when I had like spacers put on. So I guess that's when it really started. But I got braces put on in 2010, and I had them up until August 6th of last year, which was 2013. And they took them off because I had had braces for long enough, and they were afraid that like some decay could occur. So it was a nice, what do you want to call it? It was a nice respite from having to have my braces for so long. So they took them off. So I got to go my first semester of college without braces. And so back in January, I forget what day exactly, but they put my braces back on in preparation for my surgery now. Today's May 14th, and tomorrow is the 15th, which is when the surgery will happen. And so, I've been waiting for this for a really, I mean, it's like, I guess 5 years isn't such a long time, but like, it's a fourth of my life, so for me, yeah, it's kind of long. Uh, but yeah. Uh, I just wanted to kind of have a record of what my jaws look like prior. You can see how irregular the bite is right now. Mm. I should have brought a spoon in because I could show you what I can do. Yeah, I can just kind of slide a spoon in without opening my teeth and just have it sit there. Uh, I have to use my tongue as a tooth since my teeth don't go together. I have to use my tongue as a tooth instead, and so that can get pretty annoying. One thing that's bothered me a lot is trying to eat sandwiches. Uh, since my bite is basically inclined, when I'm eating a sandwich, you'll end up with a bite. You've got like sandwiches right here, and the bite will be like slanted, and so you'll end up with the bottom bun being gone before the top, and so your entire sandwich will fall apart. It actually affects like what I can eat. There are certain things I can't put on a sandwich unless I'm okay with dealing with like having the food fall all over my face. Um, I think it affects my breathing. I'm not really sure if it affects my breathing. I think it's more just my top jaw. It's stunted. Like the growth was stunted, so I'm assuming the development of all the of my maxillary up here, um, just is also stunted, which also affects like the size of my nasal cavity and makes my voice like sound however it is. Makes it feel like it's noisy. Whenever I'm talking, it's like I can feel my voice up here, and it feels like I'm talking really nasally. So I'm not really sure if it affects my breathing. It may or may not. Well, I'll only be able to tell after the surgery and see if it's different. Uh, it makes not only does it make smiling look like I don't really feel I have a smile because like when I smile, it doesn't really feel like a smile. I mean, so yeah, like a smile is a smile, but like it doesn't feel like a smile. It's not like it does. It's not appealing to me. Um, I've had a lot of people tell me like, "Oh, Graham, I don't notice. I don't really notice," and like to other people it doesn't matter, and that's fine. But they aren't the ones dealing with it, and so like when you're the one, if your smile like not necessarily perfect, but if your smile is like, what's the word? Symmetrical, I guess. If it goes together okay, it doesn't really matter to you when you can't really you're like you don't see fault like you don't see a problem with someone else's job because you're not the one experiencing it. So, um, but I mean it's like it's okay because like it, it's like it's much more a personal thing than it would be. So you can't blame other people for in a way being insensitive to it, but they can't experience it like you are, like I am. So, I mean, granted, it's not something that's like it's not life threatening, but it's like it affects my quality of life. Uh, I enjoy singing a lot, and I also enjoy acting. At least I did during high school, but like it gets to a point where you can even see in some of the pictures. I did this play during high school called Lost in Yonkers, and you can see in those pictures my jaw is like just sticking out, and it really affects your self confidence, and it's made me feel really insecure about it, and it's made me not necessarily want to audition for plays or want to uh, want to perform in general. Like I enjoy singing. I have people tell me I have a nice singing voice, but it actually hurts to sing. Like I don't have to sing long for it to get really sore. Even if I try to smile, it'll hurt for like it'll start hurting. Uh, did I say smile or sing? Smiling hurts too. Yeah. If smiling, singing, talking, eating, chewing, not only is it difficult, but it also hurts. I'll sometimes food will fall out of my mouth just because my lips don't go together, and so like you know how when your mom tells you like chew with your mouth closed, I can't necessarily do that unless I. It's like really difficult, so kind of end up like with a really messy meal. Um, uh, Yeah, sometimes when I'm talking, I'll spit on the people I'm talking to. Sometimes they won't notice, but I will. Sometimes they do notice, but they don't say anything. Um, yeah, also some people telling me they don't notice that I have that they wouldn't notice that I have it. Uh, it felt kind of odd because like they were basically invalidating the way I should feel toward it. It's like, Graham, I don't notice anything wrong with your jaws. It's like, well, that's unfortunate because there is something wrong with my jaws. Uh, but I'm excited to have this surgery because it's gonna make me It's gonna make me actually feel happy. Like uh, it's just I don't really know how to explain it. I'm just like I'm really excited for it. Not even sure if I'm gonna be able to sleep tonight, but it's I'm really excited to have it done. Um, we had a I had a what is it? Um, Originally, I think I don't even know if it was 2 years ago. I don't know. It's been going on for so long. When my I originally had a doctor named Dr. Solomon, and we were going to have it done through him. But then, for whatever reason, we came to VCU. Uh, I think Dr. Solomon recommended us, or I'm not sure exact. I forget because it's been being dragged out for so long. We originally we have this health insurance named Anthem Blue Cross Blue Shield. I think that's still their name. But we were trying to get our the jaw surgery covered by them, but the way they had it set up with my mom's employer, our our insurance plan doesn't cover orthognathic surgery just because it would cause the employer's premium to go up. And so, no matter how many appeals we made, Anthem wouldn't cover it. At one point, they even said like, "Oh well, this is actually dental surgery." I don't really. I've never been to the dentist, and they've never done any work on my jaws, on the skeletal, on like my jaws, because dentists deal with dental. I think after one point, Anthem just said, "Oh well, we're not going to cover it because your employer doesn't cover it." I don't know why they didn't tell us that to begin with, but that was, I think that was like beginning of 2013. We were trying to. I thought I was going to be able to have it done last summer, but I'm having it done not necessarily the summer, but like this end of school year. Um, so I I applied to two colleges, GMU and JMU. I got into George Mason, waitlisted for JMU, and it turned out I was able to use the student insurance at GMU, George Mason University, their student insurance, Aetna, yeah, Aetna Insurance, and so pretty much the only reason I went to college at GMU or just like college in general was because they could cover my surgery. Uh, and so we like submitted what is it? We submitted our application back last fall and we got it approved and everything. We just had to wait. I forget when we had the surgery date set, maybe back in January. But yeah, May 15th tomorrow, and I've been waiting for it for a while. Uh, I've had like support from a number of people, which is actually, I mean, it's kind of really nice. Um, I actually got kidded by some people during high school, and that was really irritating because there were some people who made it a point to, like, kind of like how some people say they don't see race. They were like, "Oh well, I don't notice anything wrong with your face, Graham. It's just like everyone else's." So, but then I would also encounter people who were like overly, what's the word? They would make it a point to say, "Oh, Graham, well, yeah, we notice you have a problem with your jaw, but we're going to make fun of it." Even had some people asking me to make the troll face for them, if any of you know what the troll face meme is. Um, and it was a way of like fitting in because I didn't like being alone in high school. So it's like it was like a really degrading and demeaning thing. But I'm really excited for this surgery because uh, pretty much like everything that happened, everything that's happened in the past few years, it's like all coming up to this point. It's finally like I'm finally having it fixed. This is a major point in my life. Now, if you want to just see kind of how it looks, yeah, it's kind of my top jaw. The growth was stunted, so my nose actually isn't being supported the way it should be. So it's kind of dips down right now, which will be fixed. I'll be like a little at least during the surgery, but I'm not really concerned about the shape of my nose. What I'm concerned about is just like how it feels to bite, how it feels to talk. This lisp that I can hear. Maybe other people can't hear it because they're not listening for it, but since I have to live with it every day, and since it's my voice and I get to I'm living with it, so it kind of gets really irritating. And it's difficult if you enjoy singing and if you enjoy acting because you can't really. I mean, it's not like people who have straight teeth and whose jaws go together that have a lisp. It's like completely different from that. I mean, I don't care if I have a lisp after the jaws are fixed. It's not that I have a lisp. It's the reason why I have a lisp. All of it comes down. All these little things that I have, like all the little problems I have, they're not so much the problem. Mainly, like rather than the reason for the problem, it's a deformity that I have. It's not just. I mean, yeah, it is how like I've grown and I was like I guess born with it, but it's like uh, it's just something that I need fixed. Um, to like actually like feel confident and feel secure with myself. Uh, it makes me feel actually like I'm younger than I am. I'm 20 years old, and it makes me feel essentially like a 15-year-old. Like I never actually went through puberty for whatever reason. Uh, I don't know. I just kind of feel that way. Um, but my doctor's name is Doctor Abu Bakr, and uh, I don't want to like I'm not trying to be offensive to him, but I'm just saying he's a very interesting person. And when I went in for basically the consultation and everything, and he basically like the way he came up to me the air I got, the whatever you want to call it, the what's the impression I got from him was like, oh, this is gonna be a fun one, just because like the how extreme it is. Um, he's been telling me I'm really gonna like the result of it, and I'm sure I am because he was telling me how long he's been doing the surgery. So I forget how long, but I'm pretty sure it's like 30 years or something, and so that kind of has me feeling more confident about having him do the surgery. Everyone here at VCU has been really nice. Um, yeah. So trying to think of anything else really. Uh, that's my profile, which is going to be drastically different after the surgery. I can actually look down my face and see my bottom teeth. And I'm pretty sure that's not normal. Uh, I back in previous years, I would just to show people how extreme it was. I would like jut my jaw out even further than normal to show them like how far it could go out, and then I'd ask them to do it, and most of the people, if not none of them, if not any of them, could like even move their bottom jaw out. Like my dad will try it, and you like can't even move it out at all. And like so, my bottom jaw basically is like really flexible for whatever reason, and it can like overextend. But the problem with that is that it like stretches your tendons and everything, and so uh, I was told to stop doing that just so my tendons could like tighten up enough for I guess the procedure I'm having done just to make sure everything was okay. I had to have my bottom wisdom teeth taken out in preparation for the surgery. Uh, and recently, I think it was back in April, I had these things called lugs. I'm not sure if you can see them. Uh, they're like they're like the normal braces that most people have. They have like little rubber band things, like the little prongs you can put rubber bands on. Lugs are basically these prongs that they put all over your braces, like in between each bracket, so that when they do the surgery, um, when they hold your teeth together, they have like this splint that they put your teeth in after they've corrected your jaws, and then they will then put rubber bands, I think, around the prongs and hold your teeth together so they can heal. They also hold. Now this is all what I've been told. Maybe I've misinterpreted some of it, but what they'll do after they basically detach my jaws from my skull. For my bottom jaw, they have to cut out bone. For my top jaw, they're not cutting out bone because they have to like basically bring it forward. Um, but they're going to put in little little titanium plates and screws to hold my jaws together, along with holding my teeth together with that splint. And so basically, I can't I can't eat solid food for a pretty long while. The estimated recovery period is 6 weeks, uh, roughly 2 months or a little shorter than 2 months. I don't know. Basically, until I feel I'm able to, or until the doctor tells me I'm able to eat solid food again, or just like open my mouth basically and start talking again. Yeah, unfortunately, I enjoy singing a lot. I won't be able to sing for 6 weeks, or so around that. So that won't be enjoyable. I like talking a lot, which will be another problem. So hopefully no one does anything funny because I don't want to have to try to laugh. Yeah, but about not eating, I'm having a tube sunk. It's called a Daboff tube, and it's not an NG tube. NG tubes are mainly for I read deflating the stomach prior to surgery, or they're like a short-term feeding tube. Daboff tubes are different. They're thinner and they're more flexible, and they go instead of just going into your stomach, they go up your nose, down your esophagus, through your stomach, and down into your. Uh, my mom said it's duodenum. I thought it was duodenum, but it's your duodenum. Basically, that's the area between your stomach and between your intestines. or your small intestine. And basically, you're on an all liquid diet, so it doesn't really matter that all the food's going to be bypassing your stomach because it doesn't need to be broken down the same way solid food would. Uh, so I'm basically gonna be eating via like a full liquid diet until I can start eating food again. And Dr. Abu Bakr actually said that like with teenagers, he won't even suggest the tube. Because a lot of them were like, "Oh no, I'm not eating the tube." When he first suggested it to me, it's like I don't want to try to. I'm probably already going to be miserable enough with my teeth and like my jaws held shut together. Uh, so I'm I just told him, yeah, go ahead and do the tube because I'm perfectly fine with having a tube coming out of my nose that I can just inject whatever into, so I can make eating as 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 not stressful as possible. Because I just want it to be it's something like I don't want to say unfortunately, but like yeah, unfortunately, I have to have this surgery done to correct something that a lot of people don't. It never crosses their mind because their teeth are more or less like even if they're not perfect, they're like not to this extent. So, I need to have this done. It's like it's a medical necessity because later on in life it could cause some complications. Um, but so I'm having this done, and I just want to make the experience as painless as possible, and as I want to make it as I don't want it to be like I want to keep it from being too inconvenient for me, even though it's obviously going to be inconvenient for me. Uh, I'm apparently going to lose some weight. Don't know how much weight because I don't really. I'm not sure if you can see. I don't know if I can really show you, but like yeah, you see my veins right there. You see my wrist. You can see the bone right there. You can even see my collarbones. I'm really skinny. I don't have any body. I don't have any like body fat on me. So I basically have no weight to lose. Uh, so I'm not really sure how that's going to happen. If I lose any more weight, I'm basically going to be skeletal. Um, but hopefully I don't lose too much weight. I think Abu Bakr said that I'll need to basically be on a 5,000 calorie a day diet, and which I'll just take from like these like high calorie protein shakes, just whatever. Basically, rather than waiting till I feel hungry, I'm just gonna basically have maybe I don't know maybe Abu Bakr will have something else, but I'm thinking like have set increments during the day that like you just put the food in or whatever, and you're like I'll get this like big plastic syringe that you put the food in and you just kind of flush it through the tube, and then you got to flush the tube with water before and after you're eating, and before and after you're taking any medication they give you. I don't really feel nervous right now. I don't really know if that'll change like the closer it gets to the time, but it's just felt like a normal day. It just feels like a normal day. Um, this has been happening a lot with me, like with things that I've like been kind of like excited for. I mean, I'm excited for this, but it's like it's just kind of like a normal day. You just go through it. It's like how else do you spend a day you're waiting for a surgery that's going to essentially change your life? I don't know. You just kind of go through it like any other day. There's nothing really special you can do about it. Uh, so I hopefully I can get to sleep before it happens. Um, yeah, so basically I've been waiting a really, really long time for this, and it's uh, I don't know. So I guess that's aside from some pictures I've already taken. I just wanted to take this video as like a record of just what my teeth looked like prior. Uh, mm, yeah, it kind of you see my lips don't go together. But yeah, just wanted to have this as a record for anyone else who may be going through this procedure, for myself, for anyone in the future, who thinks that the perfect smile I'm going to have after this was natural born. No, I can just, yeah, so this video, I'm just making this video for any of that. So, thank you for all the people who have been supporting me so far, like my parents and my friends that have been supporting me. Um, even though like they may not see the video, like I do want to mention like Dr. Abu Bakr, and unfortunately I don't remember the name of another woman who was working with but she's gonna be, she was doing my consultation and she's gonna be in the surgery room as well. So I want to thank their surgery team for like doing this, because this is like, up to this point, this is basically the only thing I have ever wanted. This is what I've been wanting for such a long time. And so finally it's happening, and I'm just really excited. So, well, I'm pretty confident it will go well, and I'll probably make a video after, maybe a year post-op video, just to show the difference between how my jaws look now and how my jaws will look in the future after I'm fully recovered. So, wish all you the best. Bye.